Dr. Michelle Marion Rhodes.
Yes.
You come to us by way of Prairie View A&M, which is in Texas.
Yes.
And you've also spent time at the MD Anderson, which is one of the world's noted cancer institutions. And you're in a very, very specific area. We've been speaking with many of your colleagues about the issue of sexuality, reproductive medicine in the face of cancer.
Yes.
An area that is often overlooked, not readily discussed between patients and their doctors, brings up issues of embarrassment, stigma, fear, all kinds of things. But your area is very, very specific. Your program is called Spirit, and it focuses on peer counseling to promote reproductive health in the African American breast cancer survivorship community.
Yes.
And I'd like to understand more about what your work is, and also what are the really important issues that are perhaps unique to the African American community.
Absolutely. Well, as you mentioned, I worked at MD Anderson with Dr. Leslie Shover in the Spirit Project, and it was designed as a culturally sensitive peer counseling intervention for African American women who've survived breast cancer.
And the acronym of Spirit?
Spirit, Sisters Peer Counseling and Reproductive Issues After Treatment. And again, we partnered with Sisters Network. The study was funded by NCI. It was a 4-year study, and we partnered with Sisters Network, which is a national breast cancer advocacy organization specifically for African American women. I'm sure you've heard of it. And Karen Jackson was very instrumental in helping to get the project off the ground. She's the founder of Sisters Network. And one of the reasons why we targeted that community is because breast cancer tends to affect African American women at a younger age. The rates of breast cancer among women under 40 in the African American community are a lot higher relative to other ethnic groups. And when African American...
And diagnosed later.
Diagnosed later, and diagnosed with more serious disease, more triple negative disease. And so one of the reasons why we targeted that community again is because women tend to be a little bit younger when they're facing breast cancer, and so issues about sexuality and reproductive health tend to be a bit more relevant to African American women, because when you're 29 years old, you're thinking about having children, you're still actively dating, and so that's one of the reasons that we targeted the community. The other reason is that we developed a peer counseling intervention because the research informs us that African American women tend to report more barriers when talking with healthcare providers about cancer, and specifically sexuality, reproductive health. And so we thought that the peer counselor modality might be a relatively important way to get the information across to survivors.
Because the issue of reproductive medicine and sexual health usually implies there's a partner involved in this.
Right.
So in this case, we'll talk about male partners.
Absolutely.
What are some of the barriers in communication that you discovered that perhaps women have with African American male partners as to their own perceptions or their own sense of self when it comes to sexual issues and their partner with breast cancer?
Well, what we found is that a lot of times what happens to your body after cancer and how sexual health might be affected is a lot of times a taboo topic for a lot of women, not just African American women. But in the African American community, obviously there are cultural issues that play out a little bit differently regarding sexuality and sexual health. Religiosity and spirituality is a very important component typically in African American communities. And interestingly, we found that women who were married and had higher reports of spirituality had more sexual satisfaction. They reported higher levels of sexual functioning relative to women who didn't. So I think it's a very complex issue in that community. One of the barriers that we repeatedly came up against is the issue of privacy, and how when you talk about sex and sexuality with women from this background, we had to we had to overcome that barrier. We worked really, really hard to recruit women to participate in the study. we had to really become involved in the community, really establish connections with Sisters Network and ensure that the information that the women provided was going to be confidential and maintained in a secure area, because a lot of the questionnaires and a lot of the information that women gave us was very personal and very private. Talking about the women specifically with sexuality, we found that about half of our women were in partnered relationships and about half were sexually active. So although the rates of marriage tend to be a little bit lower in the African American community, we did find that the women were partnered and were absolutely interested in maintaining sexual health. And that was a little bit surprising to me, because in looking at the participants that were recruited to the study, we had women as young as 29 and women all the way into their 80s. And one of the things that we learned is that sex was a very important part of their lives regardless of age. And I was a little bit surprised to find that age did not affect whether or not a woman was interested in maintaining a healthy sex life, especially if she was partnered at the time and she wanted to address that area of life.
And what about the supportive factor of the men and issues if there was a mastectomy involved?
Right.
Are there any interesting findings in regard to African American men in their reaction to their women going through the cancer journey?
I'm not sure that we found anything that was specifically related to African American men, but obviously body image issues are a huge concern for women who are breast cancer survivors. And so we developed a workbook that addressed sexual health, menopausal issues, and fertility and reproductive concerns. And one of the areas of sexual health was body image. And so women, again, were given information about how to broach the subject of what my body looks like now that I've had this mastectomy, now that I've had chemotherapy, what kinds of changes my body might be experiencing that are both obvious to men and you know, when you're in a sexual situation, you can see some of the changes, but then there are a lot of changes, as you know, that your body goes through that aren't readily apparent. And so we also had a lot of information in the workbook about how to handle things like vaginal dryness, what kinds of ways women could cope with that issue, because it absolutely affected their sexual functioning.
You know, in Southern California, there was a very interesting program about breast cancer awareness that used, really going back to very rooted tribal African American tradition of storytelling.
Right, right.
And they went to the hairdressers, and for prostate cancer, they went to the barbers. And what they did was storytelling. And so in the salon, they would talk about breast cancer to raise awareness. Have there been any programs like this where storytelling methods are being implemented to help confront these very intimate and personal issues?
Absolutely. There's been a real push in psychology and behavioral science to tailor interventions to specific cultures. And so instead of working to bring different cultural groups to the type of intervention that's standard, standard interventions, we're trying to now tailor the interventions so that they fit different cultural elements. And so that's certainly one of the things that we did in Spirit, was try to capitalize not only on the storytelling aspect, but also on the connection that women tend to make with other women. Because in the Spirit project, we didn't have oncologists and psychologists and, other healthcare providers talking to women. We had women who had survived breast cancer themselves. So it included the storytelling aspect because women were sharing personal stories to a certain extent. But then we also capitalized on how in the African American community, women tend to rely on extended kin networks, on sisterhood relationships. And so it felt a little bit different for women to receive information from someone who's been there before. And so absolutely, I think that that's one of the strengths of the program, is that we were able to capitalize on something that already takes place in that community. So it's good.
And in our own work as an organization, what we've discovered is, you talked about religion and spirituality, working with the churches.
Yes, absolutely, yes.
And one of the things that I noticed in speaking to this patient population are components of shame about the disease, which is just a huge stigma to overcome.
Sisters Network has done a lot to overcome that that shame that African American women have tended to experience, particularly with breast cancer. As I mentioned before, it's an advocacy organization specifically designed for Black women who have survived breast cancer. And so a lot of what we saw in working with Sisters Network was women going out trying to break the silence among other women who had experienced cancer. And again, I think it was a really powerful way to have women feel less shame and to be a little bit more open, because here they are talking to a woman who's experienced everything that they may be going through, and can speak to how they handled different problems and how they handled issues with their family and partners.
So Michelle, right now for the newly diagnosed Black woman listening to you,
Yes.
what are you going to tell her now as she begins her journey?
That she's not alone, that there are a lot of women who are experiencing and have experienced a lot of the issues that are going to be relevant to her journey. And I would encourage her to talk to other people, to reach out, to join different community groups, different advocacy organizations, to look on the internet. There's a lot of information on the internet. I think one of the take-home messages that I got from my work in Spirit is that resources are out there. You just have to know, where to look, and you have to be to a certain extent comfortable with talking with people. But I think what I found from working with the project is that women are very open to sharing their experiences. Certainly it's an extremely difficult thing to go through at any age, but when you're in your 20s and 30s, you can feel very isolated. But again, I think the most important thing is to seek out that support. Don't feel as if you're alone, and know that there are other women who have been there and are willing to help.
That hard part is making that overture to reach out.
Right.
And if you're not inclined to be one of those individuals, perhaps doesn't want to go to a support group, this is the one time. And I speak from my own personal experience, having breast cancer in my 20s. You have to make that first step, because once you reach out, you are really not alone.
Right.
You're in that little abyss space until you have the courage to step out and say, all right, let me be part of something, and in this case, part of a sisterhood.
Right. Absolutely. Absolutely. And so ideally, I think what would be great is if all providers were able to give women information about different ways that they can seek support in the community, because obviously your family will be there for you. But again, it's a little bit different hearing and receiving support from someone who's been there before. And that was one of the most
validates your experience.
Exactly.
And also, we cannot overlook that in the process of striving for cure. There are going to be byproducts in our quality of life, and there may be issues related to our treatment that can cause, something as simple as vaginal dryness, as simple as it sounds. It's a big deal.
Right.
But you got to talk about it.
Right. And you have to know that there are ways to help and treatment options that you can have. And I think the other thing is that obviously, when you're dealing with the cancer diagnosis, the focus is on beating the cancer. But then you have a whole life after you do that. And so one of the things that we're trying to do is to improve the quality of life for women who have survived cancer. I think one of my colleagues said yesterday that it's not just about adding years to your life, but life to your years.
That's exactly correct.
Yes.
Well, you're a big part of that. And I thank you also for dedicating your life to a community that needs a special focus, because what you said was so true. You can't impose general cultural values onto any particular culture. You've got to be culturally sensitive.
Right. Absolutely.
So thank you so very much. I look forward to watching and reading where your work continues to grow.
Thank you. I appreciate it.
Pleasure.